My name is Shelley Stein, and I serve as the chair of Genesee County Legislature. And on behalf of Chair of Orleans County Legislature, Lynn Johnson, I'd like to welcome you to our Friday Health Department press briefing. Today, we are managing our reopening of Phase 3, and it is completely within our hands. Our regional monitoring is important. Watching our daily test numbers is critical because testing provides the science. Contact tracing, finding the hotspots and addressing them directly is pivotal to our success of maintaining a Phase 3 reopening. Our public health department staff is doing a yeoman's job, and we are grateful. Thank you, Paul, and the entire department. Our reopening is to be measured by restriction, guidance, respecting, and protecting others. We ask that you pause and think of others as you emerge into the reopening businesses. Stay socially distanced, wear a mask, continue to utilize the sanitation available, and wash your hands thoroughly. If you have COVID-type symptoms, please call your primary care physician for testing. Take care with the workers who are going to be serving you. They deserve your respect. Wear your face coverings, have patience and compassion as we are all learning to work in a new way in wearing our face coverings, standing apart, and giving each other the right of way. Our reopening and Phase 3 is our opportunity to prove our resilience in following the best scientific guidance available. Wear that mask. Get tested. Together, we're going to save lives. Collectively, our counties are working hard to set up more testing capacity in our rural areas. Testing that provides data to see where the virus is living and possibly growing. And we will communicate our expanded testing through our health briefings in the future. Seriously, our behavior is the key to protecting our health and the health of others. Some who are more susceptible to the virus than you. And knowing how much we miss socializing, and we are frustrated, and we want to have that sense of freedom of our daily life prior to COVID-19. Yet our best path to gaining that sense is to remain distant, just for now, until we can be together again. I ask you to take your contact with your family and friends as special, not for granted. Be respectful of your behavior towards others. Know that there is guidance for the phase reopenings that is confusing. Please stay patient with us and understand that we do this together for each other. And the one event that we all do not want to have happen is to re-enter into New York pause or back to a phase 1. That is a real possibility if the COVID cases rise at a fast pace. I ask you to choose wisely in your behavior as you have exhibited these last 100 days. I ask you to be well and stay safe. I now introduce Paul Pettit, the Public Health Director of Genesee and Orleans counties. Thank you. Paul?
Good afternoon, and thank you, Chairman Stein, for those words. Once again, you've summed up my whole report in your 2 or 3 minute introduction, so I appreciate your articulation of the position of where we are, and the wise words that you're articulating and sharing with our residents. Chairman Johnson wasn't able to be here this afternoon, so again, she wanted to reiterate very similar messaging to the effect that Chairman Stein just shared. So again, welcome to everybody, and we are officially in phase 3. The opportunity to move forward through this process is something that we all should be very pleased with and happy about. We've done a lot of hard work, a lot of sacrifice over the last 3.5 months now, and we are getting some things back to some semblance of normal. We are moving forward in the process and moving in the right direction. Our data continues to remain very positive. It's trending in the right directions. We monitor it every day. We check and see where we're at with the different data points that's required to be monitored by the control room. And things have all been trending in the right direction. And, again, that's one of the primary reasons the governor announced yesterday that we were moving into phase 3. And now we are officially there. Those activities and those different businesses that were listed are open and, obviously under the different guidelines that are out there. But it is a new day, and we are heading in the right direction. So as I've done most of the start of these Friday press briefings, I wanted to just take a second and thank the residents of Genesee and Orleans County. I think it's always important to recognize hard work and sacrifice. And once again, the data, the proof is in the pudding, so to speak. The data is heading the right direction, and a lot of that is due to the hard work and sacrifice that our residents have done over the last 3.5 months. It's not been easy, oftentimes frustrating and challenging, and a lot of angst amongst you folks at home and us in the local government. But we have persevered, and we've met this challenge together. We've worked hard together, and we're going to continue to move forward together. So again, I just wanted to thank everybody for their hard work and getting us to where we're at. And brighter days are ahead for us as we move through the process in the different phases here. I did just want to note real quick, this is from Jack Walsh, our CAO in Orleans County. They're, as far as the DMV, they're still waiting final guidance before Orleans County makes a decision on opening up the DMV for appointment only. But again, they hope to have an announcement about that coming up very soon related to the DMV. I know Genesee County put out an announcement around that. But Orleans County, they still have not moved forward with making a final determination on that, so he just wanted me to share that with everybody. All right, so I'm going to run through the data. We usually do a couple talking points that I want to go through and highlights on some of the things, and then we'll open up questions, and we can proceed from there. So as of 2 p.m. today, again, our cutoff standpoint, Genesee County has received 0 new cases of COVID-19. So again, that is 0 positive cases. This is the second day in a row that we've had 0 cases for Genesee County. So we still sit at 201 positive. So again, very good news on that front. 0 of the previous community cases have recovered. So we're still stuck with, sitting at our 5 folks in isolation. So no one else has been, released from mandatory isolation. 0 of the total active cases are hospitalized. For Orleans County, we have 1 new positive case being reported today for a total of 247 cases. That individual resides in Carlton, in the town of Carlton, and the individual is in their 60s. They were not on mandatory quarantine prior to testing positive. 2 of the previous community positive cases have recovered from Orleans County, and 14 of the active positive cases are hospitalized for Orleans County. And again, please note we don't designate or differentiate between the hospitalized between the regulated facilities and community members, again, trying to respect their privacy. Also for Orleans County, again, I'm very saddened to report that we have a loss of another county resident with COVID-19. This individual was a resident of the Orchard Rehabilitation and Nursing Center. Again, I'd like to express our deepest condolences to the family members and friends of that individual during this difficult time. It's never easy having to stand up here and announce these, but again, unfortunately, we have lost another county resident. Before I go through the overall kind of cumulative data where we're at, I just want to take a second to remind everyone about respect and being polite and respecting people's individual privacy during this time, especially for cases that may be positive or under quarantine for an exposure to COVID. As we've talked about many times, we here from the health department, we do not share specific information because we are bound by HIPAA privacy and HIPAA regulations. But it's also important in the community, on that side, just to make sure that, we're respecting other people and respecting their privacy. If there are concerns or complaints about someone or a business, et cetera, use the appropriate channels that are available, to make complaints or to share concerns. Again, it's just important with any situation, including and specifically regarding health information, that we respect others and, be considerate of their health information. So with that, just going to run through our total cumulative. So currently Genesee County, again, is at 201 positive, 6,029 negatives, 5 folks in isolation, 49 in quarantine, 5 total deaths, and 140 recovered. Orleans County, 247 positives, 3,346 negatives, 7 in isolation, 25 in quarantine, 49 deaths, and 97 recovered. So again, we continue to track those, and the tracking system that we have up on the website is a good place to go for a quick pictorial of where we are with our data. Again, that this is something that was put together and we've been utilizing for a couple months now, and this covers Genesee, Orleans, and Wyoming County. So we would encourage folks to go to this site and utilize it moving forward. Again, this is updated Monday through Friday. No updates on the weekend, but it does give a good snapshot of both active and cumulative cases and what's going on throughout the different towns and different counties in our 3-county region. So we encourage folks to visit that as desired. All right, so again, our age breakdown is there. I'm not going to run through those directly, but they are on the press briefing, and then also our non-counted public regulated facilities are there, and you can see the numbers. Just as a reminder, if the numbers are not on there or a facility is not on there that you may know to be a non-county public regulated facility, that's because they don't have any positive cases. So we're only going to add those to that list when we have any confirmed cases. Again, the goal here is not to add them because we do not want to see cases within these facilities. A lot of them are, our prime high-risk population categories. So again, if we can keep COVID out of those facilities, that will be a primary goal that we have. So as mentioned, we're in phase 3. It opened officially today, Friday, June 12th. So we again want to remind those businesses that happen to be phase 3 businesses that you hopefully by now, if you're open especially, have developed your business plans, that you've gone through and done your attestation, and that's officially brought up, and been done through Forward New York. And again, we're not reviewing these plans. These do not need to be submitted. But when you go to the Forward New York webpage, you'll see a lot of information there. A lot of the information that I've been talking about around the regional trends. There's that data there. There's information on all the phases, phase 1, 2, 3, and 4. It's listed there. So again, businesses, there's a lot of detail, a lot of guidance is there, especially for the first 3-phase businesses now. So we'd encourage anybody that falls in those categories to go to that webpage, forwardnewyork.gov, and go through, look up the information that is vital to your establishment. Again, there's a specific guidance that you have to meet, the requirements that are there. In addition, there's the attestation for the business to go through and attest that you've read the documents and you've developed a safety plan. And then finally, there's also the template there. So for those folks that need some guidance and assistance in developing their safety plans, there is a downloadable, fillable template that is there that we're encouraging all folks to use. Has a lot of great information. It literally walks you through the process, the talking and the different areas and the places that we want folks to spend special attention in developing in their plans around protecting their employees, protecting any volunteers and any folks that may come into your establishment or into your not-for-profit, whatever group you may have. And that information should be developed and accounted for in that plan. So please use that template. It is there. It's easy to use. It's fairly intuitive. As we've talked about many weeks now, every establishment is different. So again, it needs to be customized to whatever the logistics and the population that you work with. But it is there, and we would ask that folks use that and fill it out. Again, we are not reviewing these at the health department, so they do not need to be submitted to us directly. Keep them on site, keep them available if someone asks for them or you need to provide them for some purpose. But again, make sure they're on the premise and available. We also want to make sure that if you happen to be potentially in a phase 4 business, and we've been saying this right along, you may have an opportunity to get going before phase 4. As we've seen many times now, since we started the phase process, the governor has opened up and changed somewhat the businesses or the different activities that have been opened up and allowed to occur. So as we are now in phase 3, looking forward to 4, if you happen to be in one of those different categories that's still in phase 4, there may very well be an opportunity that one of the governor's press conferences, he announces that some new activity has started, and he's providing guidance and guidelines for a different activity to get going. So our message is really be ready. Make sure that you've done the work, put your plan in place, because again, we want folks to be able to get back out there and get to those activities as quickly, but of course as safely as possible. And part of that will be having the plans ready. So again, if you have to be phase 4, et cetera, work on your plans now. Get ready. Your turn may come quicker than we may know at the moment. All right. So again, there's a lot of guidance on for New York for all those different activities. Again, I'm not going to read through the guidance and to go over them, but if you happen to be one of those businesses as far as restaurant and food service activities and or personal care, there is a lot of information up there for you. Please review it and make sure you're compliant with all the different requirements. In addition, just a couple other areas that were announced this week, just so everybody's aware, garage and yard sales, they were given the green light this week. Again, there is specific information as far as how those are to be conducted. Again, taking into account social distancing at these events, So again, make sure you go on and review the guidelines if you happen to be hosting one of those garage or yard sales this weekend. To make sure that you're compliant, and again, protecting others as they, come to your property and peruse your belongings that you happen to be selling. In addition, pools and spas and spray parks, those were all opened up this week. So again, there is guidance there on what the requirements and how to do this safely and appropriately in line with the guidelines. So again, make sure that you're referencing those if you happen to have a private public pool. At a facility and or, one of these community-based settings. In addition, municipal playgrounds and parks were also given the green light to open. And again, this will be done by the municipality. Not all parks are going to be opening immediately that we've heard. So again, it depends on each municipality, whether it's a town, a village, a county, etc. They may open up at different phases depending on when they feel they're ready. So again, there is guidelines for them and how they need to have them set up and ready to go. So they're obviously monitoring that as things move along. We still remain in the 10 or less for the governor's order. So again, social distancing for groups, assemblies, meetings, etc., unless carved out. So again, we're getting a lot of questions on this. We're not at 25, we're not at 50, we are still at 10 people or less. Again, unless the governor has carved out some of these different activities and groups where it's percentage-based. So again, for faith-based, it's 25% capacity still. So obviously that's going to be over 10 for most businesses and organizations. They're faith-based groups. So again, unless it's been identified, it's still at 10 or less, and this is through June 21st. We've been saying this date over and over again. We don't know what's going to happen on June 21st. Whether the governor is going to lift that number and raise it up to 50, 100, we're just not sure. We may very well extend it depending on what's going on with the data. We're very hopeful, again, based on what we're seeing locally and regionally, that 10 will be lifted, that larger groups can start to gather again, taking into account social distancing and masking, but we just don't have the answer for that at the moment. So we're going to continue to monitor, and we'll make sure to include that in our press briefings and push, and I'm sure obviously the media that's on this call here will have that information probably as soon as we know. So again, we'll get that out as soon as we can. Just following up on a press release we put out yesterday on a positive case that attended the event on Sunday. Just a reminder there, we are encouraging folks that did attend that, if they happen to become symptomatic or they feel they need to be tested, they should go do that. Obviously, the governor's been talking now for well over a week that anybody that attended any of these rallies and different events throughout the state should essentially consider themselves exposed at some level, because again, these a lot of groups were well beyond obviously the number of 10, and not necessarily social distancing and mask usage kind of was hit or miss in some of these groups. So again, we encourage folks that need to seek out that testing again if you did attend one of those different events. Again, just real quick, for New York is the one-stop shop for all things COVID-19 related to businesses and anything coming out of the state. So we're going to continue to push folks there repetitively. That is where you need to go for the most up-to-date and most the current guidance that's out there. Also, New York remains on pause, and there is a complaint line. So if there's a business or something that you're concerned about seeing in the community that may not be following the guidelines, et cetera, and you are desirous to put in a complaint or concern on that, there is a process for that. Again, we've been pushing that information out. There's a phone line and also a website that folks can go to if they choose to, again, lodge complaints or concerns with businesses. Contact tracing, again, this is a very important part of the COVID process moving forward. We know that identification of cases and contact tracing and isolation and quarantine are the keys to really suppressing outbreaks and making sure they don't become widespread in the community. So it goes along with testing, identifying positive cases, and then looking at those contacts and monitoring them and getting them out of the population, so to speak, so they're further spread. So again, currently in both Genesee and Orleans County, all the contact tracing is occurring by the local health departments. Again, with the very low activity numbers we have right now, again, a very good thing. We are able to handle the contact tracing internally. So any type of contact will be coming from the health departments, and then obviously we've talked about this many times, but the state does have a contact tracing team that is working independently of the health department, so to speak, but collaboratively with us. So if it comes to the point where we need to utilize them for contact tracing, we'll let folks know that. But then at that point, potentially phone calls could be coming from those contact tracers and those touch points. So again, currently right now, all contact tracing is occurring locally by our health departments. Okay, swabbing and antibody testing. So along with contact tracing, as mentioned, swabbing and testing is very important in helping us continue to have the numbers trend in the right direction. Again, overall in our communities, it has not changed much from last Friday. We are working hard on identifying additional testing locations for our folks. We are hearing some additional pharmacies coming online. Unfortunately, not any of the ones in our 2 counties. We are working on that, trying to get some of these chains like CVS and Walgreens that have announced testing in some of their chain locations, trying to get them to open that up locally within our counties. We are also working with some other agencies to try to improve community access. Hopefully within the next week or so, we can announce some additional testing options for our county residents. As of right now, that hasn't changed. At the moment, you still need to call your provider if they happen to be doing swabbing. Again, as we've been announcing on the antibody side, URMC sites in Genesee County and Well-Now Urgent Care are both doing antibody testing. But beyond that, again, there isn't any local sites doing that. Testing-wise, again, UMMC at Penn City and providers, and again, Well-Now are really the only options locally. So again, continuing to work on that, we will provide additional information as we get it. And again, we are advocating and pushing hard on this front because we know it's very important. We know that we have been very frustrated over the lack of local testing, so we continue to push hard on that, and hopefully soon we can announce some good news on that. All right. Also, again, if you have the press briefing there, you can see that there's a lot of links, a lot of information, again, available for folks to go get guidance. I do want to remind everybody of the Rock COVID-19 Health Screener. This is a symptom tracker for the Finger Lakes region. So again, we've been talking about this every week and encouraging folks to go on and sign up where you text in potentially any symptoms that you may have. And this information is put together, aggregate data by zip code, and can provide the local health departments a tool in identifying potential hotspots or increases in activity that we may see moving forward. So again, if you're interested in that, that is available. Obviously not a requirement, but we would encourage folks to sign up. As we, talk about every week, mental health continues to be a very important piece of the puzzle here that we continue to hone in on. It's been a long 3.5 months now, going on 4 months. And it's something that we really want to, again, reiterate as we do every week, that there is help out there, that there is encouragement, there's hope. Those folks that may have been, socially isolated over the last, again, 3.5, 4 months, anxiety, depression, whatever it may be, seek out help. It is there, it is available in both of our counties. We do have a care and crisis helpline that's available 24/7. So please don't feel like you're alone. There is help out there. We want to make sure that you're seeking and getting whatever you may need. All right, the last thing I just wanted to announce real quick, and this is more for our media folks that have me on the call. We're kind of rebasing our interaction media strategy moving forward. It is in the press briefing, but we will be sending out the press briefings as we do every day at 4 during the week, Monday through Friday. We are not going to be putting out numbers on the weekend, so Saturday and Sunday you're not going to be receiving a update on numbers. There is availability on the State Department of Health or the Forward New York website where folks can go on and see where the numbers are. Just a little footnote on that. There is sometimes a bit of a discrepancy between the numbers we report and what are reported on there, just due to the lag in how we pull the data. It's not exactly lined up. So Monday morning and Monday throughout the day, as we prepare to do our 4 o'clock release, any of the numbers will be updated. Obviously, our mapping tool will be updated, so that will be reflective of, again, the data that we've continued to provide over the last 3+ months. So again, just wanted folks to be aware of that. We're not going to be putting things out on the weekend unless there's a need for it. So again, if there's something that comes along that requires a press release, something significant that we feel we really need to push information out on, we will obviously do that. It's very important to communicate that to the public. Also, the Zoom briefings that we're doing on Friday afternoons at 4, we're going to be moving those to be scheduled as needed. We're not going to continue forward with the every Friday at 4 moving forward. But again, this probably won't be the last one we do. It's just not going to be on a reoccurring basis. So we will put out announcements well ahead of time to all of our media folks so that they have time to prepare and be able to participate. But again, we're just shifting our strategy a little bit to make sure we're providing the information that we need to, but also taking some other things into consideration. So again, the information's on there. If you have direct questions outside of the press briefings we put out Monday through Friday, you can contact our PIOs directly. And again, I know you have their contact information. So with that, we'll unmute our press, and they have to be on the call if they have any direct questions for me, or if Shelly's still on the call, she's more than welcome to answer any of those directly. So we'll open you folks up now. Just please, again, state your name and what news outlet you happen to be from, and I'll do my best to answer the question, or we will get you the information when we can.
Tom from WBTA. Just a question about the parks and swimming pools. What is going to guide your decision-making on when to open those up?
So again, the parks and pools, as I mentioned there, the parks specifically, municipal and or village, etc. They'll make that decision when the town or the village county is ready to open them up, for the different facilities within them. There isn't a mandate necessarily that they have to open, just like with restaurants or anything else. Maybe some of them did not open up today; they're just not ready. Because again, it takes time to meet the requirements and the guidelines. So as far as those facilities are concerned, again, that's going to be a decision made locally. As far as the pools, again, depending on where they are in the process, so if they're pools that are public pools, again, those are regulated by the health department. So if and when we receive the request by the operator to open that pool, we obviously have to go out and do a pre-operational inspection and make sure that they have all the their safety plans in place. Beyond the COVID plan, which is their general safety plan, making sure that the disinfection, everything's up to speed where it should be and is safe to utilize. So again, I know my staff has been out doing those pre-operational inspections already. And so again, that'll kind of roll out as these facilities are ready to open those different activities.
Okay, thank you.
Yep.
Hey, Paul, it's Howard Owens. How you doing?
Hey, Howard, how are you today?
Good. So, Paul, asking you, I guess, to give your best guess or your best input. If we do start to see more cases, would we expect necessarily to roll back phases when, people have come a long ways from when we first started? As nobody wore masks back in February and March. Businesses didn't have, sneeze screens in front of cash registers and everything. We didn't have the social distancing protocols. I think it'd be reasonable to guess that just as we interact with people more often, there will be a bit of an increase in cases. Do you think that society has come further enough to maybe not roll back to the strong restrictions?
No, I mean, that's a great question, Howard. I do believe that we have come a long ways.
You're not on screen right now, FYI. Somebody changed the...
Oh, we're having an issue with the camera.
Well, it sounds like we're having an issue with our camera on our end. Can you still hear me?
Can hear you fine, yes.
Okay, all right. Yeah, so, I think it's one of those things that we have come a long ways. As Chairman Stein said earlier, a lot of what is occurring with the transmission of COVID is behavioral, as far as interactions. And, I would like to think that there's going to be more taken into consideration when it comes to how we move forward in the data. You're absolutely correct. I mean, as testing increases, and you've seen a lot more testing, and as those numbers go up, that shouldn't be the only indicator of potentially putting us back on pause. We don't have the full answer, and as we talked about all along, a lot of what happens here lies with what the governor decides he wants to do with this. What we can do locally is we can continue to advocate. We can continue to talk about common sense public health approaches from our perspectives. We have a state association that my counterparts are part of, and we continue to push and lobby and advocate. And then obviously locally with the control room, there's a lot of ways that again we can advocate. I think led to some of the changes that I mentioned earlier occurring prior to what the governor originally had intended. So, my thought is, again, with the changes in society, the different approaches that we've taken, I believe that really it lends itself to behavioral changes, and that should be taken into account and should be, part of the equation if, again, we start to see the numbers climb.
Great, thank you. I also wanted to give you a chance maybe address the protest a little bit more from two respects. One is just kind of your level of concern about that somebody had been there who was symptomatic and tested positive. And then also, well, why don't you tackle that and I'll remember the second part of my question.
Good, because I didn't want to forget the first part. So obviously we talked about this last week, and I encourage everybody that planned on attending this event to do it as safely as possible, and to make sure that they were taking into account social distancing, wearing masks. Obviously, we've been talking about since day one, stay home if you're ill, right, if you're symptomatic. Going back to my last comment about this being behavioral based, people have to make choices. People are responsible for their actions. And, if someone chooses to go out and they're symptomatic, they choose to go to the store, they choose to go to a friend's house, a relative's house. I mean, these are decisions that people make every day. They have free will to make these decisions. And, what we're asking folks to do is to really consider the implications if someone's ill and symptomatic. That's not the time that they should be, out in the public, whether it's COVID, whether it's the flu, or any other type of, virus that could be spread. So again, this individual that was out, we just wanted to put out this information. So we made folks aware. I mean, we've been telling you since day one, if we ever got to a scenario where there was a contact or a case where we couldn't comfortably determine all of the close contacts, that we would put that out, similar to what a lot of other counties you've seen do over the last few months. With this event, obviously, with the close contact, even with the reported mask wearing, et cetera, we just don't know. There's still obviously a chance because, in that type of environment for a prolonged period of time, there's obviously a chance of spread. So again, the goal here was to make folks aware, and to just, again, let folks know when you're out and about and, you know, you start to open things back up, you still have to be considerate, you still have to think through, and be cognizant if you're symptomatic, especially not to go out and attend these type of activities and events.
Paul, you actually addressed pretty much the second question, which was because a couple of people brought it up to me why, you know, where this person was released when it hadn't been previously. And I've explained that was part of protocol, and you've hit on that. You may not know this information or may not be able to put this fine of a detail on it, but as you know, as somebody who was there, I've been curious whether this was somebody who's, you know, just hung around on the periphery, or if it was somebody who's really centrally involved and kind of at the eye of all the activity. Do you know?
I actually cannot speak to the specific details of where they were at the moment, Howard. We do know that they spent a significant amount of time at the event, and they, the individual reported that there was, you know, obviously they were part of the speeches and different activities in the crowd. So again, that's why it makes it very challenging. When we put information out like this, we really can't pinpoint direct contacts. You know, so that's why we're basically saying anybody that's there needs to really monitor for symptoms, you know, and get tested. And you know, really we can't do much more than that, and just trying to, again, make notification for folks to be able to self-monitor. How important do you think it is that this person wore a mask the whole time they're there? Well, obviously, as we've been talking about all along, the mask component is extremely important. You know, when we talk about the face covering, right, whether it's a mask or a bandana or whatever type of thing, that's protecting others from you, right? So we're not talking about the N95, the medical grade, where you're protecting yourself from others because the virus can't get through. So when we talk about social distancing and protecting each other, you know, this is why the mask is so important, especially when we have a lot of cases of asymptomatic spread and people not identifying symptoms. The person, you know, that's out and about, if they have a mask on, they're containing spit, spray, cough, sneeze, etc. within that barrier, which again is protecting others from you. Is it foolproof? No. Is it possible that, you know, there's still a possibility of spread even with a face covering? Sure. But again, it reduces and really minimizes that risk and exposure. Thank you, Paul. Have a great weekend. Yeah, thanks, Howard. You too.
Hi, this is Mallory Diefenbach from the Daily News.
Hi, Mallory. How are you?
Good myself. I know that you had mentioned earlier that there were some discrepancies, but I was looking at the website and I noticed that for Genesee County, there's 4 active cases and 141 community recoveries. And the numbers that you gave out today was 5 which are in isolation and 140 recoveries. I was just wondering if there's a reason for that?
Yes, so I was actually off screen here telling me that I must have I missed one when I spoke. So it is 141. Yeah, so I can always count on you, Mallory, to hit us with the data. So we appreciate that. You keep us honest.
All right. That was my question. Thank you.
Yeah, it's tough when we have all these numbers. Like I said, we work hard. We're working with many different divisions, our nursing, epi, pulling numbers. They're working with the PIO to put these together. And then frankly, I have to read it right. So it's probably not them, it's probably me. And, so I'll take the blame on that one. And, they're working hard to try to, again, get as accurate data as possible. Any other questions? Okay, so again, we're not going to be putting out updates over the weekend. If you're looking for numbers, you can refer to the State Department of Health. They do have active numbers there for all counties throughout the state, and we will be updating and updating the mapping tool on Monday. And as I mentioned, our last formal Friday briefing, I want to just thank everybody for their time and going through the journey with us. It's been a long one so far, and we're not quite out of the woods, but we are trending in the right direction. And again, we will hold these briefings as needed and as warranted. Our goal here is still to be transparent, to provide real-time factual data to our residents, and we will continue to do that, maybe just in a little different format. So with that, I hope everybody has a good weekend, stay safe, social distance, and hopefully go out and enjoy some of the new open phase 3 venues. So with that, I'll sign off. Have a good weekend. Thanks.